Hello, my name is Jenna Romer, and I'm here today to tell you guys why smoking is harmful. These are my audience members and my cat. What would you do if you were told that you may not live long enough to see your children get married, or grow old enough to have grandchildren? Imagine being at risk for illnesses such as cancer. My goal is to teach you about the harm smoking brings and how you can prevent these things from happening if you quit smoking. I believe it's important information for others to know because it can save their life if they quit smoking or never even start it. Today, I plan to convince you to reconsider smoking by discussing the health effects of smoking, the cost smoking has on our personal finances and the economy, and how to quit along with the benefits that come with quitting. So let's start by looking at how smoking cigarettes affects the body. According to Smoke Free from www.nhs.uk, it is stated that every cigarette you smoke is harmful to the human body. Smoking is the biggest cause of preventable deaths in England, accounting for more than 800,000 deaths each year. 1 in 2 smokers will die from a smoking-related disease. When you smoke, toxins attack your insides, which cause your body to rot. If you could see the damage, you'd stop, but many people ignore this fact and don't care to learn, but really they should. Smoking harms multiple parts of the body, including circulation, the heart, stomach, skin, bones, the brain, lungs, mouth, and throat. When you smoke, the toxins from the cigarette smoke enters your blood. The toxins in your blood that makes your blood thicker, which increases the chance of clot formation, your blood pressure, and also your heart rate. This will also make your heart work harder than normal, which is not good for your body. Smoking is bad for the heart because it damages your heart and blood circulation. These damages increase the risk of conditions such as coronary heart disease, heart attacks, strokes, peripheral vascular disease, which is damaged blood cells, and cerebrovascular disease, which is damaged arteries that supply blood to your brain. It is a proven fact that smoking doubles your risk of having a heart attack and twice the risk of dying from coronary heart disease than lifetime non-smokers. The good news is that after only 1 year of non-smoking, your risk is reduced by half. So when you stop for over 15 years, your risk is similar to someone who has never smoked before. Smokers also affect the stomach by giving themselves an increased chance of stomach cancer or ulcers. Smoking weakens the muscles that control the lower end of your gullet and allows acid from the stomach to travel in the wrong direction. It is also a significant factor for developing kidney cancer. The more you smoke, the greater you are at risk. Research has shown that if you regularly smoke 10 cigarettes a day, you're 1.5 times more likely to develop kidney cancer compared to a non-smoker. This is increased to twice as likely if you smoke 20 or more cigarettes a day. Smoking reduces the amount of oxygen that gets to your skin. This causes your skin to age more quickly, which nobody wants. Smoking prematurely ages your skin between 10 to 20 years and increases your chance of face wrinkles and hollow cheeks. Many find this quality unattractive and may push others away from dating or being around you. The good news is that once you stop smoking, you will prevent further deterioration to your skin caused by smoking. Smoking also causes your bones to become weak and brittle. It increases your chance of a stroke, which can cause brain damage and death. Your lungs can be affected very badly from smoking. Coughs, colds, wheezing, and asthma are just the start. Smoking has caused 84% of deaths from lung cancer and 83% of deaths from chronic pulmonary disease. Smokers tend to have a hard time breathing due to the narrowing of their airways and destruction of lung tissue. They tend to form a smoker's cough, have trouble breathing when active, and also frequent chest pains. It is obviously pretty clear that smoking is very unhealthy to our human body. Smoking also causes unattractive qualities such as bad breath, stained teeth, gum disease, and can even damage your sense of taste. The most serious damage smoking causes in your mouth and throat is an increased risk of cancer to your lips, tongue, throat, voice box, and your gullet. More than 93% of oral cancers are caused by smoking. In addition to smoking having a harmful effect on their own body, it also affects their finances as well. My audience is still here. Smoking affects your health as well as cost of money. Cigarettes are expensive and quitting can save your money now, as well as saving on future health costs. If you need an added incentive to quit, think about how much of your weekly income is going up in smoke. According to www.swedish.org, if we spend approximately $7 per pack of cigarettes as an average in Washington state, and if I smoke about 2 packs a day, I'm spending almost $400 a month. That's $14 a day multiplied by 28 days in 1 month. That's a car payment, airplane tickets, box seats at a Seahawks game. It's more money in your bank if you aren't spending it on cigarettes. It is also proven from www.betterhealth.gov at today's prices, if you smoke 1 pack of cigarettes each day for 10 years, you'll spend almost $77,000, easily enough to buy a new car or put a deposit on a house. So stop wasting your money on cigarettes and go out and spend it on yourself or even others. This money could even be used for a good cause for many organizations around the world, even cancer. In addition to the cost of smoking everyone is familiar with, there are also other costs that contribute to smoking. According to www.learn.eversmoke.com, many smokers do not realize their health and insurance costs goes up due to their bad habits. For example, life insurance is higher for smokers since statistics show that smokers have a shorter lifespan. Healthcare is also known for smokers to spend more money on due to the increased frequency of illnesses. With this increase in healthcare, there's also an increase in medication cost. Smoking in a home can raise the homeowner's insurance due to a higher risk of a house fire. Statistics also show that smokers get into more car accidents than non-smokers, which cause their car insurance to go up. This may be caused from them being distracted while trying to light up their cigarettes or even whenever they drop their cigarettes. Lastly, dental care can also increase due to dental problems from smoking. Smoking can decrease a home or car value possible by thousands of dollars due to the odor and stains smoking brings. If the finances didn't convince someone to quit smoking or to never start, there are many other solutions that can work that come with many benefits as well. So when you quit smoking, the body automatically becomes healthier. When it comes to quitting smoking, many people find it challenging, but it just takes dedication and somebody who truly wants to quit. www.healthguide.org states the first real step to stop smoking is the start step. Each letter in START stands for something. The S stands for set a quit date. Choose a date within the next 2 weeks so you have enough time to prepare without losing your motivation to quit. If you mainly smoke at work, quit on the weekend so you have a few days to adjust to the change. The T in START stands for tell family, friends, and co-workers that you plan to quit so they can help you. A stands for anticipate and plan for challenges you'll face while quitting. So set goals. The R stands for remove cigarettes and other tobacco products from your home, car, and work, so you won't be tempted to smoke. And the T stands for talk to your doctor about getting help to quit. Your doctor can prescribe medication to help with withdrawals and suggest other alternations. It is known that quitting is very hard, especially withdrawals. It is important to stick to your goal and exercise a lot, and time will help the withdrawals go away. During these withdrawals, distract yourself from smoking and remind yourself on why you do not want to quit, or why you do not want to smoke. Changing the scenario you are in might take away these cravings, and also rewarding yourself will help as well. The rewards don't only come from the things that you buy yourself, but many others as a non-smoker as well. There are many benefits that come from quitting. When you quit smoking, your body will begin to heal itself. The levels of carbon monoxide and nicotine in your system will decline rapidly, and your heart and lungs will begin to repair the damage caused by cigarette smoke. Within 20 minutes of smoking your last cigarette, your blood pressure drops to normal, and your pulse rate drops to normal as well, and your body temperature of hands and feet increase to normal. 8 hours from quitting your last cigarette, your carbon monoxide levels in blood drops to normal, and the oxygen level in blood increases to normal. 24 hours after you quit your last cigarette, your chance of heart attack decreases. 48 hours, nerve endings start regrowing, and your ability to smell and taste is enhanced. 2 weeks to 3 months after quitting, your circulation improves, walking becomes easier, lung function increases up to 30%. 1 to 9 months, coughing, sinus congestion, fatigue, and shortness of breath decreases. Cilia regrow in lungs, increasing ability to handle mucus, clean the lungs, and reduce infection. Body's overall energy increases. After 1 year of quitting, your excess risk of coronary heart disease is half that of a smoker. 5 years of quitting, lung cancer death rate for average smoker decreases by almost half. Stroke risk is reduced to that of a non-smoker 5 to 15 years after quitting, and the risk of cancer of the mouth, throat is half of that of a smoker's. 10 years after quitting, your lung cancer death rate similar to that of a non-smoker's. Precancerous cells are replaced, and the risk of cancer of the mouth, throat, esophagus, bladder, kidney, and pancreas decreases. And lastly, 15 years after quitting, your risk of coronary heart disease is that of a non-smoker. So basically, you've become normal again. So in conclusion, nothing good can come out of smoking cigarettes. You're not only putting your own health at risk, but your finances at risk as well. Quitting smoking will bring many benefits to an individual in their health field and as an individual themselves. Smoking has no benefits to your body physically or financially. So I hope that by listening to my speech, you are better aware of the effects smoking has, and hopefully this speech makes you think twice if you're thinking about putting a cigarette in your mouth. And if you're a current smoker, it is best advised that you quit today. Thank you. And this is my audience.